is in my early work in hospice work, I was asked to go out to a very young woman's home and who was dying of a head and neck cancer. She was born in Greek mythology. There was a class of beings called, that it loosely translated, is the sufferers, and the sufferers would suffer so the rest of us didn't have to so much. And this was a young woman who was born with significant cerebral palsy to a very poor family in Fort Worth, Texas. Was raised by a father who just couldn't accept all this very well and had a horrible drinking problem. She was physically abused and eventually sexually abused. In order to escape this, at a fairly young age, she began to leave the home and had a child out of wedlock, and eventually married the father, who abused her further and began to abuse the child. At the tender age of 23, developed the head and neck cancer, which is nearly unheard of. It's very rare. And by the time I had the opportunity to meet this young girl, she had been through the medical system and all therapies, and had a head and neck tumor that was very invasively enveloping her entire neck area up into her face. She was actually a very beautiful young girl before she got this, but it had blocked off the venous return so that her head was quite swollen and blue. She had big scarred up areas. She had had a previous neck dissection, so she was quite disfigured. And the tumor had so invaded that it was much like the Elephant Man. When she came out of vertical, she would obstruct her airway. The surgeons had offered her the opportunity for an attempted tracheostomy, but she had so much tumor that they really felt that she would bleed out. She had bled several times and had life-threatening bleeds. And they told her that she very possibly would not survive the tracheostomy to open up the airway and keep it open. And they would have to go right through the tumor, which they really didn't relish doing, and she chose not to do that. She came into the hospice program, and I was asked to see her on my lunch hour. She had just come into the hospice program. She was thought to be actively dying, and her major complaint was that she hadn't slept in 2 weeks, when in reality she would fall asleep, but the minute her head would fall out of the vertical, she would stop breathing. Her airway would collapse. She would stop breathing, and she would wake up gasping for breath. So she was horribly sleep deprived. She had a major unfinished business in that her husband was in jail, and she knew that the one thing she needed and wanted to do was to protect her child, get her child into her mother's, the patient's mother's custody. So she had major unfinished business and knew that she did not want to die yet. So she wanted some ways to be able to be more comfortable. They had tried sedative medications, but found that that only hastened her falling out of vertical position and having obstructive symptoms. The patient knew that she had the opportunity to have palliative sedation, which is being put to sleep or sedated so significantly so as not to be bothered by this, but in all likelihood that would end in her death. And she wasn't ready for that at this point. So I was called on my lunch hour to see this woman. I drove over to her home, which was in a poor home on the bad side of the tracks in Fort Worth, Texas, and in very quick order said that using your imagination is a way to work with this, and that sometimes you can program the way that we program our body when we're asleep to carry on vital functions in certain ways, in certain positions. And to my surprise, she was an incredibly gifted hypnotic subject. My first mistake was when I asked her to relax, and she settled out of the vertical and immediately turned purple, and I said, "You can relax in the vertical position." And what she showed me within 45 minutes was that she could go into a profound level of trance. She was given suggestions for staying in the vertical. We helped her find some props in her room. And she practiced during that 45 minutes going into and out of trance, going profoundly into this, feeling herself drift into sleep, I would re-alert her. She would come back. We would practice again. I gave her suggestions for the inside of her mind, being able to regulate this, whether awake or asleep, that even small changes from the vertical would alert the inside of her mind to be able to make those adjustments. And what I found was that I was humbled by her abilities when awake and asleep to stay in the vertical. She slept well that night, all night. And she, over the next several days, was able to sleep at night, stay awake during the day, spend time with her small child, prepare the child, make the necessary legal arrangements. And she lived for almost 2 weeks. And during that time, she had good pain control, good relief of anxiety, and much better sleep. And when the major threat to her life not only was the obstructive sleep apnea, but also many of these patients bleed to death. And we talked about that. I only saw this woman twice, and on the second visit we talked about how she would like this to be through the rest of this. And she talked about bleeding out. She talked about how scary that might be for her little child, and whether she should send the child someplace else. And what she decided after talking through this was that she needed a way to feel safe through this, so that she didn't feel frightened. We talked about red towels, which would hide the sight of the blood and absorb if that should happen. We talked about ways to do that, and we talked about Dan Brown and Erica Fromm's safe place imagery, which she had very firmly for herself, a wonderful image from her childhood, a safe image, and one that she readily could go back to. And I get chills even talking about this to this day. They found her one morning dead, having bled out, with a smile on her face, with red towels that she hadn't even woken anyone. She had placed around herself, and she was found smiling with her fingers in her okay sign for going into trance, and she had done this all herself. So for me, it's a remembrance, a humbling of the power that we have, and that things like hypnosis and other things can help people unlock the inner potential. So it's not a favorite story, but it's a powerful story for me, and it reminds me to be sometimes ferocious, the way Harold is ferocious and others.